Well, hello everyone. I want to start by wishing everybody a very happy St. Patrick's Day. If you're as Irish as I am, that's pretty important. We'll talk a little bit about that at the end. I also want to use a somewhat unusual title because we're going to update where we are with COVID. We're going to talk about vaccines and mutants and rollouts and rollbacks of precautions and what's wise and what's unwise. And to do that, I think we really need to put everything in perspective of where we are. And so what I do for this talk, I call this the race of the century so far. The century is still kind of young. So why do I say that? Well, I think that it's very important to understand that we are in a race right now, which the medical epidemiologists, the people who have been working for over a year to try to stop this pandemic, are kind of fearful and closing their eyes as they watch this race take place. This is, as you know, if you're a sports fan, the race season. So what do I mean by that? Well, the races you think of are things like this. In the winter, the year starts with the Daytona 500. It's pretty neat. As you move to the spring, the Boston Marathon, granddaddy of all human running races. And you go to May, something special if you're from Kentucky, the Kentucky Derby, the greatest horse race. And then late in May, Memorial Day, comes the Indianapolis 500. The race that I think dwarfs all of these is this one, the greatest race of the century so far. And that's this virus versus this vaccine. And if you're an epidemiologist, you're cringing trying to watch what happens because we have held this virus in relative check. Probably 2/3 of the deaths have been avoided at least. Probably 3/4 of the infections have been avoided at least. And we've done that with distancing, closing down transportation, keeping separate, masking, hand washing. Now, people are getting tired. They're stopping to do that because they think the existence of a vaccine means they're done, or just their political realities they're trying. And that's very fearful because the reality is the vaccine works, the vaccines work, but we have to talk about which and what's the difference is. But so many of the world has not had a vaccine yet. In the United States, we vaccinated 10% completely, 20% partially, and we have probably another 10% that have had some protection by actually getting and surviving the infection. This means that 80% of the United States is still quite possible to catch this coronavirus, go through infection, death, and another surge. And that's not counting the mutants, which we know are variations of the coronavirus, which are more contagious and more virulent. And we don't quite know how the vaccine tackles them. So we definitely want to stop it before it can mutate even more virulently. So what does all that mean? Well, first you have to understand what these mutations are. This is an RNA virus. It's very sloppy about the way it replicates. Mutations are common. And you actually use those mutations, if you're a scientist, to mark what type of virus strain you're dealing with. You can actually trace it as it travels, etc. As they did that, they noticed three major mutations. There are many more, but the ones that are pertinent are the British mutation, which is very easy to catch. It actually pushes aside the older versions. That's important because the vaccines were tested mostly against the older versions. And we know the British is much more easy to catch, which means more people die. It's not quite clear if it's that much more virulent, or it's just because it makes it more common. The South African and Brazilian variations are important because Brazil is relatively close to us, and these are fairly similar mutations, which may not be easier to catch, but are much more virulent. It's important because some of the vaccines we don't have here in this country have not been very successful against the South African variant. Fortunately, the ones that we have appear to be at least helpful, if not completely protective against them. But these are present. It's important to know that mutations are happening all the time, and the real key they need is a lot of people having the disease or some animal vector, such as weasels, minks, etc., which is one of the reasons why we vaccinate people who farm minks, because we're trying not to have it spread from animals to people again. Then the other side is the vaccinations. Now let's just take vaccinations as if they were all the same. We have places like Israel where the majority of the people have been vaccinated. For me, that's a living laboratory. We can see what works and what doesn't by looking carefully at what's happening in Israel. In the US, 11% have been totally vaccinated, 20% have received one dose, which means they have about half immunity. And then herd immunity is about 80% or more. So no one's really there. Israel's close. But most of the world, this huge incubation area to bring out a new strain, which could overwhelm even a vaccine, we have less than 1%, and most of the world has been vaccinated. So this is a big problem, and it means we are responsible not only for ourselves, but for the world. And if you've been working in global health as much as I do, you know how important that is because vaccines don't respect borders. Virulent viruses don't respect borders. We have to get the vaccine where the disease is if we want to protect the world, people around us, and ourselves. Okay, so a mutation needs a big reservoir. It could be there's a lot of sick people. It could be that if you have carriers, people that aren't that sick, but don't eliminate the virus completely, probably because they're immunocompromised, those people can actually be turning the virus over within them until a more virulent mutation comes out, and that's what spread. Animals can do it as well. Vaccinations would limit that opportunity by not letting the immunocompromised people become sick and carry it for a longer period of time. So you can see why people like myself have been pushing to immunize these people with risk factors and do it sooner. The first logic was the people that are exposed every day. That made sense. Now things are beginning to get political about who gets vaccinations, and we have to talk about that. One of the reasons that we're concerned that people won't get their vaccination is because they're afraid, either because people have given them misinformation, often on purpose, or because they are legitimately afraid. It's important to know that all vaccinations have side effects to different degrees. Some are related to the exact type of vaccine or the dose. In other words, a large dose of vaccine, you're going to have more of these side effects, but you may be more able to fight off the true virus when you get it. Muscle soreness, fever, chills, fatigue are common, not universal, but common. Most everybody has at least a sore arm. Rarely there are severe allergies, and one particular vaccine is being looked at now because it may increase clotting, which can be fatal if it's in heart, lungs, brain. Side effects are more common in the young and more common with the second dose or a larger dose. Now that's important. It makes sense to me in that the young who throw off the primary disease better than the old have a supercharged immune system, and therefore if they get a large dose in a vaccine, they may have more of these temporary symptoms. It's just their immune system revved up. The second dose could be you've revved up and therefore you have it more. And of the vaccines you know about, the Moderna uses a larger second dose than the Pfizer does. We seem to see more with that second dose. Now, of the authorized vaccines in the US, Pfizer, Moderna, and J&J, they all are efficacious. The first two were measured against the, as it were, original coronavirus, and they were 95% effective. We don't have good data on how effective they are against these new mutants. Now, that British mutant is so easy to catch that it'll replace the old coronavirus in this country within a month. It's going to be the dominant form. So we'll find out quickly. The initial look at these vaccines in other countries suggest it is effective. J&J was actually tested during the rise of the South African mutant, and it did stop it, but not completely. It was very effective against the older variation, less effective against the newer, but the people didn't die. They may have got a mild case. So there's no question it's a reasonable thing to take. There's no question it's helpful. And because it doesn't require the deep freezing or the second dose, it's going to be used very commonly once J&J is able to make enough of it. Now, right now, Pfizer and Moderna are revving up faster. They talk about hundreds of millions of doses, J&J about dozens of millions of doses. But as it comes and we want to spread something around the world, that's what will spread. The other vaccines you should know about, in my opinion, are the AstraZeneca, which is the one that we had great hopes for, the one out of Oxford. And we studied it here at UW. But the efficacy was never clear, and it was never approved in the US. It's now being halted in Europe because of concerns about blood clots. That may be true, it may not, it's not clear. Most scientists think it's probably not, but you can see the difficulty of using it or not. So many European countries have called a halt till they can examine this. That's important because the United States has a big stockpile of AstraZeneca's vaccine. If we're not going to use it, would it be useful in other parts of the world? Well, there's a problem. We're not going to be giving people a vaccine that we don't approve. That's this sort of colonialism where we give something we wouldn't use to other countries. That's not happening. So we really need them to figure that out because they have doses that people could use if it is safe. So the next question is manufacture and distribution. We have bought hundreds of millions of doses, primarily of the first two and less so of the third that have been approved in this country. As the new administration took hold, used their war power acts to cause other pharmaceutical companies to make the Pfizer and Moderna vaccines here in this country in their plants, because we're buying it all and giving it away for free, we've been able to ramp up. We're now giving out vaccine at 3 times the rate that the administration said they would. That's really good. And each state, including Wisconsin, is giving out a tremendous percentage of what they get very efficiently. And we can be more efficient as they make more. This means that the possibility of getting vaccine to everybody that wants it has gone from it taking 2 years, which was the rate we were at the beginning of this year, to 3 months. And the target is June, to actually have everybody be vaccinated if they want it. And our job must be to provide that, but also to convince people that the safety and efficacy of the 3 that have been approved. That's important because we are all in it together. Just as we need each to mask and separate, if we don't want another huge surge of virus, that's the same. Because it is surging, and it is surging elsewhere in the world. As we've rolled out the vaccines, we're seeing that this enthusiasm that, gee, I see the light at the end of the tunnel. I can therefore rip off my mask, go to any restaurant I want, open up sports venues, as is happening in 2 of our states right now, and will soon be in others. We have a problem because we're nowhere near vaccinating enough people. And Countries like Italy, which like us were devastated by a big surge which overwhelmed the hospitals, and then as that surge went down, began to think they were past that, are now again flooding their hospitals. We know, for example, that Paraguay and Brazil are overflowing their hospitals. These are areas where they did not have it before. Why? They were just lucky. Now their luck is running out, and they have only 1% of their population vaccinated. So we've got a responsibility. If we're going to take care of our own, that's fine. Let's do it quickly, and let's take care of the rest of the world because they are us. And the schedule was December for healthcare workers. That made sense. By February, we were doing elderly and essential workers, defined differently in different states. Now in March, we're defining essential workers as including teachers, and then individual states will define other people. Medical comorbidities come shortly in April, and that's very broadly defined. You know from what I've just said how important it will be to get the immunocompromised people inoculated because we don't want them being overwhelmed by the virus, nor do we want them carrying it and growing new mutants. So for the good of all, we want those medical comorbidities done. That's coming quickly. Interesting enough, in this state, obesity is considered a medical comorbidity. So in Wisconsin, that's going to cover an enormous number of people, along with diabetes and other such areas. But that means that we can't handle that all at once. We can't handle all the teachers all at once. So we're going to have to be much more organized. Unfortunately, the government is loath to organize it too much, and individual states are going on their own. And I'm afraid it is chaotic. We will have to organize online scheduling of appointments. It looks like it's going to be a series of websites that'll tell you where they have it because the government's going to give this extra doses to your health systems, to your drugstores. And pretty soon everybody's going to qualify because by May, probably late April, every adult will qualify. And that's important because when we get that group done, we'll be at herd immunity. And the studies are now going on to see if and when children should be inoculated. And I strongly suspect the answer is yes, and as soon as we show it's safe. Exactly which vaccine is a difficult question. I think this might be one with a J&J with one dose, which is not refrigerated, which is effective, if not fully, partially against the mutants, may be very good in the children. We'll see what the data shows. So what do we do? Watch the variants worldwide. Hospitals are filling in Italy because they are poorly vaccinated. Although they had that same massive surge we did, they really involved only 20% of the population, so 80% are susceptible. Campuses are our big U.S. source of disease, no question. Duke is now locked down. And that's, in the midst of, gee, we're past this. We're not past this. We've all done so very much. We have to do so much more to keep healthy. We're not done. Mask, distance, wash hands. If you're eligible, please do get one of the U.S. approved vaccines when eligible, unless you have some sort of medical contraindication. And remember, we're in this together. We have to look out for others and worldwide, because worldwide they can't distance. They do mask, they do not travel, but they live together tightly. And we need to get vaccines to them because we have a worldwide responsibility. But what I'm saying is we have the possibility of beating this. We could goof it up by delaying or allowing it to surge again. I am concerned even about Wisconsin's numbers, which have plateaued at about the level we were in July and August before our big surge in the fall. And remember, there's nothing about us, 80% of us, that means we could not get it again. And if there's enough of this virus spreading around, a mutant which overwhelms the vaccines could appear. We can make a vaccine to the new mutants, but it'll take 6 months if we keep working at record pace. We don't want to be chasing our tail all the time. We want to end this and reduce it to a minor hold that we may need a booster shot yearly for, something of that nature. Because coronavirus, without these mutations that made it so severe this past year and a half, is the common cold. It's one of those viruses. We'd like it to be that mild. So I leave you finally with Happy St. Patrick's Day. And I think this is actually more important than you think, because this man who lived 1600 years ago is famous for lots of things, religion, etc. I tend to think that he is a person who went to other countries to heal people, both spiritually and medically. In Ireland, he's known as the patron saint of epilepsy, which is kind of important for neurosurgeons. And it was he who started this whole thing about traveling to help other people. And that's pretty neat. So I want to leave you in honor of my mother on St. Patrick's Day with an Irish blessing. May your troubles be less, your blessings be more, and nothing but happiness come through your door. So we can do this. You're doing great, but keep it up. And if you can get vaccinated, do so. Thanks very much. I'd be happy to take any questions if there are any. Anyone want to top the Irish blessings? That's okay too. All right. So we will distribute this to everybody so that nurses, etc., that are on their shifts can see. But it's a very positive message. We can get through this. Just continue to be careful. Understand what they're saying when they talk about mutations of vaccines, etc. Don't panic because the one that we didn't approve might be having trouble elsewhere. That's why we test and approve things. Thanks very much. Bye now.